occupational therapy is looking at an individual's occupation. And so that means that the things that we take for granted on a daily basis, such as like toileting and bathing and those kinds of things, are very important to individuals, but until you have an insult or an injury, you don't really understand the importance of what does that mean to you as an individual. Some of the things that we also look at are meaningful occupations, and those meaningful occupations are individuals have an insult or injury, and because of that they're not able to do either leisure activities if they're older. We're also looking at play, and what does that mean for a child. When the students actually first come in, they start to really understand what is occupational therapy. So that means that the students themselves have to do a lot of analyzing, and so based on that analysis they start to really look at, okay, so what is the problem? If the individual had an insult or an injury, how can we get them to regain those skills again? So the uniqueness of our program is that we're a 2-year program. We have a newly remodeled lab. We also have a hospital room within our lab. We actually work with our community partners. So within the Elmhurst Speech Clinic, within ELSA, which is working with individuals that have intellectual disabilities. Based on that, we're not just looking at an individual person, we're starting to really look at a population. We got accredited in April of 2018. When you graduate our program, you actually are a generalist. So that means that you get opportunities from across the lifespan. So you may be in acute care, you may be in a rehabilitation center, you may be in a skilled nursing facility, you may be in schools, you may be in mental health. The job of an occupational therapist is actually a valuable job because we really do look at meaningful interactions with individuals and meaningful occupations that individuals do on a daily basis.